Hi everyone, my name is Lovasi and welcome back to my radiology review series. So make sure to like, subscribe and share, and let's get started. Station 5, describe the image. What is the most likely diagnosis? And here comes the answer. So the image shows a PHS X-ray that is not rotated with a good penetration and aspiration. And then the heart is significantly enlarged with a global, smooth and rounded contour, depicting a classic water bottle sign. So this is what I mean. I'm sure you can notice that the heart shape here isn't as it normally is. So this is the smooth and rounded contour that I was talking about. And then what is the most likely diagnosis? So of course this is a pericardial effusion. The reason this is not cardiomegaly is because like I said previously, as you can see, the heart is taking a rounded and smooth contour. Unlike in cardiomegaly where the heart maintains its normal shape, but then it just appears much bigger than normal. But then here, as you can see, you have this nice and smooth rounded contour, which is just indicating that there is fluid around the pericardium. So definitely this is a pericardial effusion and not cardiomegaly. Station 6, describe the image. What is your diagnosis? List 5 possible causes of your diagnosis. And before I get to the answer, I would just like to go over a few basic concepts with regards to MRI. In a T1 weighted MRI, fat appears bright and water appears dark. And then in a T2 weighted MRI, water appears bright and fat appears bright, but not as bright as in T1. So basically these are almost the opposite, T1 and T2, such that in T1, fat appears bright and water appears dark. And then in a T2, water appears bright and fat appears bright, but not as bright as in T1. This is the only exception because instead of fat appearing dark, it appears bright, but just not as bright as in a regular T1 weighted MRI. And then we also have what is known as FLAIR images. So FLAIR simply means fluid attenuated inversion recovery. So FLAIR basically inverts the signal of water, making it appear dark. So we can have a T1 FLAIR or a T2 FLAIR. Notice that in a T1 weighted MRI, water appears dark, but in a T1 FLAIR, fat remains the same and water appears much darker compared to a regular T1. And then for a T2, notice that water appears bright, and then in a T2 FLAIR, water appears completely dark and fat remains the same compared to a regular T2 weighted MRI. So in neuroimaging, FLAIR generally refers to T2 FLAIR unless specified otherwise, as this is the most useful for detecting subtle abnormalities like tumors and infarcts around the ventricles and cisterns, which would be obscured by bright signal from the CSF in a regular T2 weighted MRI. So basically what this is saying is that in a normal brain, we have the ventricles here, and then in a normal T2 weighted MRI, they appear bright. And then this hyperintense signal would obscure some small pathologies like tumors or infarcts. So what FLAIR does is that it inverts the signal from CSF, making it appear dark so that the small abnormalities in the brain can be more clearly seen. So if you are to take away one point from this slide, is that in a T1 weighted MRI, fat appears bright and water appears dark. And in a T2 weighted MRI, water appears bright and fat appears bright, but not as bright as in a T1. So now let's answer station 6. So let's just have one more look at the image. So let me just zoom in a little bit. I want you to pay attention to this particular area right here. So this is the spine, and then these are discs, and that's the spinal cord. Okay, now we can try to answer this. So the image shows a cervical T2 weighted MRI depicting disc herniation. So why are we saying this is a T2 weighted MRI? Remember we say that in a T2, water appears bright. So I'm sure you can see that this is CSF right here. and then it appears bright. And then fat appears dark. So of course fat is appearing dark here because this is the spinal cord, and then the spinal cord is made up of a fatty substance, so it appears dark in this case. So the image shows a cervical T2 weighted MRI depicting disc herniation at the levels C4, C5 and hyperintense signal in the affected spinal cord region, indicative of cord edema and ischemia. So there is hyperintense signal in this particular region, and then depicting disc herniation. This is the disc herniation that we're talking about. So I'm sure you can see the disc here, and then it slightly herniates into the spinal cord at the level C4, C5. So basically you can just count from top to bottom. And hyperintense signal in the affected spinal cord region, indicative of cord edema and ischemia. So basically what happens here is that whenever the cord is compressed, it becomes edematous, meaning its water content increases. And then remember, we said this is a T2 weighted MRI, and in T2 water appears bright. This is why the cord in this particular compressed region is appearing kind of white. I'm sure you can see the white here compared to the rest of the cord. So that is indicative of cord edema secondary to the compression here. There is also effacement of the CSF space around C4 to C6. So this is the area around C4 to C6, and there is effacement of the CSF space around this region. So what do we mean? I'm sure you can see the bright rim here and here, and this is supposed to be constant throughout the entire spinal cord. But then whenever you have a spinal cord compression, you're going to have loss of this bright rim on the compressed side, because whenever there is compression, it's like the CSF is going to be displaced away from the spinal cord, and then you're going to have a loss of the bright rim around the spinal cord. So that's what I was describing here. There is effacement of the CSF space around this region, as evidenced by the loss of the bright rim around the spinal cord. And of course, the diagnosis is spinal cord compression. And 5 possible causes of this diagnosis, we've got these here. So spinal cord compression can be secondary to disc herniation, spinal stenosis, trauma, tumors, or arteriovenous malformations. So in this particular example, the spinal cord compression was caused by disc herniation, as you can see here. Station 7, describe the image. What is your diagnosis? What is the most common cause of this pathology? Describe 4 key imaging findings in this pathology. And here comes the answer. So the image shows a T2 weighted MRI of the upper segment of the right lower limb. So this is the leg, as you can see here. This is the right leg, and then this is the left one. And then there is bone marrow edema in the upper third of the right femur, as evidenced by hyperintensity. So this is what I'm saying. There is bone marrow edema here, as evidenced by hyperintensity. So hyperintensity simply means bright. So I'm sure you can see that the femur here appears bright. And then this is because of bone marrow edema. So when something becomes edematous, its water content simply increases. So we say this is a T2 weighted MRI. The upper segment of the femur appears bright compared to the other parts. And then there is also corticodestruction or breakdown of the bone surface. So if you look closely here, you can see some bone destruction here. So what is your diagnosis? Of course, this is osteomyelitis of the right femur. So osteomyelitis is simply an infection of the bone. And then what is the most common cause of this pathology? So of course, the most common cause of osteomyelitis is Staph aureus, except for special cases such as in sickle cell disease, where the most common cause of osteomyelitis is Salmonella, because these particular people with sickle cell disease have immune dysfunction, and also they have functional asplenia. And because of that, these patients are highly predisposed to infections by encapsulated bacteria. And then describe 4 key imaging findings in this pathology. So in osteomyelitis, you can see focal lytic lesions, Lytic lesions basically appear as hypodense areas, especially on an X-ray. You're going to see a nicely white bone, but then you're going to have these lytic lesions which appear much darker, indicating bone destruction. And then you can also have dead bone fragments, which are known as sequestra. And then you can also have an opening in the bone cortex, known as cloaca. And then you can also have bone marrow edema, which is what we were looking at in this particular image. This was a T2 weighted MRI, and then because of the edema, the water made the image look bright in this particular edematous segment right here. So here are some few clinical notes with regards to osteomyelitis. X-ray is the first diagnostic modality of choice because instead of doing an MRI, we would rather start with doing an X-ray, because most of the time X-rays are able to show us these particular changes that are seen in osteomyelitis, except of course the bone marrow edema, but we're able to see the cloaca formation, the sequestra, as well as the focal lytic lesions. Lastly, station 8, describe the image. What is your diagnosis? Describe 4 key imaging findings of this pathology. And here comes the answer. So the image shows an epi X-ray of the right knee depicting joint space narrowing with osteophytes. So if you look at this image, this is an epi frontal view of the right knee. This is the right, depicting joint space narrowing. So when you take a closer look, I'm sure you're able to notice that on this side, the joint space is much narrower compared to this side. I know this is a subtle case, but when you know what you're looking for, it's going to be easy to identify the pathology. And also osteophytes are seen. So osteophytes are basically bony outgrowths originating from the periosteum. So if you look at this image, you're able to see an osteophyte here, which is a bony outgrowth originating from the periosteum. You're also able to see a few here and here and here. So basically, like I said, once you know what you're looking for, it's going to be easy to identify the pathology. Then what is your diagnosis? Of course, this is osteoarthritis of the right knee. And then describe 4 key imaging findings of this pathology. So in osteoarthritis, these are the key imaging findings. You have joint space narrowing, like we saw here. You have joint space narrowing on this side compared to this side. And then bony outgrowths originating from the periosteum, which are osteophytes. And then you can also have subchondral bone cysts and subchondral sclerosis. Thank you for watching. That's it for today. See you next time.